Hi guys, this is Dr. Megan Marie DeLegas, physical therapist. I've gotten the question of, do I think physical therapists have to be athletes? And I do think that in some ways that's a simple answer and a somewhat complicated answer. The simple part is it depends what field of physical therapy somebody is in. So if someone's in neuro rehab or geriatric rehab or pediatric rehab, there might be some moments where sure it's beneficial, but maybe not the most prioritized thing that they are. So when it comes to something like outpatient physical therapy or sports physical therapy, I think that clinicians have to have experience in sports or performance in some capacity. Does that mean they have to be actively doing it all the time? No, I actually don't think they do. I just think they have to have experience within it. And the reason is because a lot of injuries or return to activity go hand in hand with a proper exposure to load and recovery. And if someone has not experienced certain levels of fatigue, certain performance requirements, certain strength programming, then it'll be hard to create those kinds of parameters in programming for their clients. And so as somebody like myself, for example, I've dabbled in many sports. I used to play soccer growing up. That was my biggest sport, but I used to dance. I've done marathon distance running. I practice yoga currently. I've done CrossFit. I did Olympic weightlifting at times. I still do high intensity interval training. And so while I may not do all those things at the same time, I have had experience in various realms of athletics and just general fitness. So when I program for somebody, I will, if someone has chronic pain, we have to expose them to a certain amount of stimulus to create change. And so if we ourselves as clinicians aren't aware of what that feels like or what that is like, it is going to be harder to communicate that. And while I do think it's still possible, I also think that we're more likely to explain something and to communicate it in a way that is digestible if we've experienced it ourselves. I think that goes hand in hand with a lot of things in life, right? And so I don't necessarily think someone has to be actively performing the sport that they are coaching or rehabbing somebody in, but I think they have to understand the principles, the experiences, perhaps have even had an injury themselves. It makes it that much easier to communicate and bridge any sort of communication gaps that you might have with your client. And so some principles and some recommendations I have for clinicians that are students is to get programmed or get a coach or try a sport and express, or at least document or reflect on what they're experiencing on, so that when they come to a point where they're communicating those same things to patients, they can do it themselves. I'm kind of going back and forth between the word patient and client. I see them as the same thing. So just so you know, as a viewer, they're the same thing for me. So I would say, long story short, yes, some experience is definitely needed to be very active in it. It depends at what level clinician you are. If you are working with professional athletes, and you're going to have to expose yourself to a lot of the things that you are going to be coaching them through. But if you're just talking about some more general, chronic issues, then just building from a lower foundation, then no, you may not necessarily have to be at an extreme level athleticism or performance, but just being in constant knowledge or experience or just educating yourself within it is pretty critical. At least that's what I believe in. That's why I'm teaching classes. That's why I do practice a lot of the things that I give to my clients and my patients when I am rehabbing them, or even just trying to get them stronger after rehab. So that's very long-winded, but if you have any questions about that, or if you have any opposing thoughts, please let me know. I'm always open to hearing them, and I'd love to have that discussion. So shoot those below in the discussion or question section, or shoot me an email privately at megan@meganmariept.com. Thanks, guys.